Welcome to the Fibromyalgia Podcast. I'm Tami Stacklehouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stacklehouse, and this is episode 103. Today's episode is all about your thyroid. When I'm meeting with a new student or a client, one of the first questions I ask is about their thyroid. Having a properly functioning thyroid, along with having your body do the right things with that thyroid hormone, is a huge piece of managing fibromyalgia. This is so important that I spend an entire week teaching only about thyroid as part of our Certified Fibromyalgia Advisor class. In this episode, I've invited my thyroid doctor, Dr. Kaley Bourgeois, to talk about the kinds of thyroid issues she sees in her practice and how she treats them, particularly with her fibromyalgia patients. If you have ever had a doctor tell you that your thyroid is normal, you need to listen to this episode. Dr. B explains why your doctor probably doesn't know how to treat your thyroid and why you're being told your thyroid is normal when it may not be. Treating thyroid is a critical piece of managing fibromyalgia, and you will hear why in today's episode. This subject, it's near and dear to my heart. This is part of my story. Uncovering and treating my own thyroid disease was a major step forward in getting my fibromyalgia under control. All my life, I've had some of the classic symptoms of low thyroid, like being cold when everybody else is fine, but my doctors have always told me my labs were normal. Then, in 2009, 2 years after my fibro diagnosis, I lost a third of my hair. That was scary, seeing all that hair at the bottom of the shower when I would get done. It was frightening. And of course, I saw my doctor about it. And fortunately, she had had some extra advanced thyroid training. She ran a bunch of labs, including a full thyroid panel and a thyroid antibody test. And as we went over them, honestly, most of my thyroid numbers were pretty normal. We're going down the list. Normal, fine. That's, within range. Holy cow. Those aren't normal. And that's when she saw my antibody numbers. My thyroid antibodies indicated that I actually have Hashimoto's. Hashimoto's is an autoimmune condition where your body thinks your thyroid is evil and tries to kill it. My body had been quietly killing off my thyroid, little bit by little bit, slowly, gradually, in a way that just didn't show up on my labs. But the antibodies were there. And if things had kept progressing, eventually my labs would have shown it as well. After my body killed off enough of my thyroid, it wouldn't be functioning well, and that would be reflected in the labs. So treating my thyroid, yes, it gave me my hair back, thank goodness, but it also significantly improved my fibromyalgia symptoms. I had less pain in my hands, particularly my fingers and my joints. I had less pain in my legs. I had more energy. I could think better, less brain fog. So today, Dr. B and I are going to give you a basic understanding of thyroid science and treatment. But if you need more personalized help, definitely consider, if you're anywhere near Portland, Oregon, going to see Dr. B at her clinic, Framework Integrative Medicine. Honestly, I would recommend any of the providers in her clinic. You are also welcome to schedule a consultation with me or one of my coaches. No, we're not doctors. We aren't going to treat your thyroid, but we can absolutely help you find a doctor who can, and we can help you ask for the right labs. We can help you interpret those labs, know what follow-up questions to ask, and teach you about the treatment options. As I mentioned earlier, this really is something I teach all of my students in our Certified Fibromyalgia Advisor class. Somebody asked me recently, what's the difference between the information on the podcast and the information in the class? And honestly, the answer is nothing. I teach the exact same thing to you here that I teach my students in class. However, how you apply that information is very different. Today, of course, Dr. B and I are talking in general terms. We're teaching you in general about thyroid and what labs to get and what those numbers should look like. But in the class, we are going to talk about your labs. One of the homework assignments is to get a full thyroid panel, including antibodies, and to analyze them with the information that you're taught in class. There is a big, big difference between learning about thyroid in general and learning about your thyroid and about what you should do about your lab results. We will have information on the advisor class if that's something you're interested in today's show notes. Just go to fibromyalgiapodcast.com/103. And now I want to introduce you to today's guest. Dr. Kaley Bourgeois is a licensed naturopathic physician practicing integrative family medicine in Tigard, Oregon. That is a suburb of Portland, for those of you who do not know. After 10 years of full-time practice in Lake Oswego, another suburb of Portland, she opened Framework Integrative Medicine for patients seeking a functional medicine approach to disease prevention and health optimization. Dr. B offers preventative medicine visits to all ages. She offers diagnostic labs and imaging, therapeutic injections, IV nutrient therapy, women's wellness exams, and cosmetic medicine. After earning her Bachelor's of Science in Exercise Science at Pacific University, Dr. B completed her medical training at Portland's National College of Natural Medicine, where she most enjoyed her rotations in endocrinology, that's thyroid, by the way, women's health, IV therapy, naturopathic cardiology, pediatrics, and minor surgery. She went on to expand her postdoctoral training at the Institute for Functional Medicine and obtained her certification in ozone therapies, platelet-rich plasma, PRP therapy, and cosmetic injections such as Botox and Juvederm. In practice, Dr. Bourgeois found her greatest passion treating complex chronic illnesses such as autoimmune disorders, fibromyalgia, chronic fatigue syndrome, and mast cell diseases. She believes early identification and intervention are the key to enhancing everyday wellness. On the weekends, Dr. B enjoys running and exploring Oregon's parks with her husband and her 2 kids. Now, remember, the information that you're going to hear in this podcast is designed to be for educational purposes only and may or may not be the best fit for your personal situation. It is not meant to be medical advice. Well, Dr. B is a doctor, and she's frankly my doctor. She is not your doctor yet. Therefore, please always check with your own physician or your medical professional before trying or implementing any information here. And as I said earlier, if you're anywhere near Portland, Oregon, I highly recommend seeing Dr. B so you can get her professional advice for your specific situation. Here's my interview with Dr. B. Hello, hello. Welcome. I'm so excited to have you back on the podcast.
Hello, Tami. Thank you. Nice to be here.
Now, as I mentioned in the introduction, y'all, this is my thyroid doctor. So we are going to be talking a little bit as we do this discussion. And as I mentioned at the beginning, a little bit of my own story. We can use me as our, example of things. But I'm really excited to talk about thyroid. To be totally honest, this was one of the big steps forward for me. And it's one of the things I have known I've needed to talk about on the podcast forever. And so I am so excited that you agreed to come chat with me about all things thyroid.
Hey, I love thyroid. Thyroid is fun for me.
So why don't we start with just like some basic science? Like, what is the
What the
thyroid
heck
gland? What does it
Where is
do?
it?
Yeah.
Yeah, absolutely. That's good. I'll talk a little bit about like TSH in that too, just because sometimes people think that's thyroid hormone and it's different. So your thyroid is this cute little butterfly shaped gland in the front of your neck. You can even push on it and press on it. I say cute and little, it should be. Sometimes they're not cute and little, they're like big. That's a goiter. So your thyroid, I like to think of it as your producer for energy, right? Like we know mitochondria do that. All the cells in your body have to create energy, but thyroid produces the hormone that turns on metabolism. It affects body temperature. It affects how well you process sugars, proteins to produce energy in the mitochondria. It does everything, which is why it's very sneaky. And when you have too much thyroid or too little, it's not like you get one or two common symptoms. You can have symptoms all over. You can have skin changes, hair changes, digestion changes, heart changes, everything. So it is our fantastic little energy producer. Our brain regulates it. We have our brain tracking how much hormone we have. And then it likes to yell at our thyroid when it's not putting out enough via a signal called the thyroid stimulating hormone. That's that TSH. And when it's functioning well, when the brain is doing its job, which we can get to later, it doesn't always do it right. But when it's doing its job, if the thyroid's not putting out quite enough, the TSH will rise up and stimulate the gland to put out more hormone, or it'll get quieted down when it sees a lot of hormone circulating.
So it's kind of like it yells louder or it doesn't yell as much.
Yep. And that's a common thing that gets confusing for people because a high TSH means low thyroid, right? Whereas a low TSH means high thyroid, usually. That's
Right.
in kind of classic primary thyroid issues.
Right. But that, of course, requires everything in your body to be functioning properly in order for that to be a good indicator. And since we're all here on the Fibromyalgia podcast, there's a good chance that all the things in your body are probably not functioning exactly like they should. So,
A bit of dysregulation.
right, exactly. So before we get into all of that, what are some of the symptoms that people might be experiencing if they're having issues with their thyroid?
So I would say more common, we're going to be talking about the symptoms of hypothyroid, not enough thyroid, which is when you see that TSH usually going up. That is classically low energy, hair falling out, gut motility slows down. So you're more likely to see things like constipation, IBS constipation, gastroparesis, where the stomach doesn't empty well, poor exercise capacity. That's a big one. Like when people notice they try to go out and exercise and they just don't have the endurance or they don't recover well afterward. They have a lot more of that soreness than myalgia, which can be confusing, right? Because you already have fibro. That's a very common symptom. Depression. A lot of people, when they feel depressed, they might have hypothyroidism that got missed or subclinical hypothyroidism that their doctor doesn't realize should have treatment sooner rather than later. Dry skin. Oh my, what else?
One of my big ones was always everybody else in the room would be totally fine and I would be freezing.
Yes. Cold intolerance is what we call that. And then when it's pretty bad, you can get something called myxedema. Really, you're just looking for swelling, puffiness in the hands and the feet. That's a really big sign of it. The tricky thing, though, is that in the United States, the leading cause of hypothyroidism is Hashimoto's. It's autoimmune. And in the early stages of that, when your immune system is attacking your thyroid gland, you don't always have low thyroid. In fact, early on, you can have years and years of normal thyroid numbers. They run your TSH. It's like, oh, your brain says everything looks great. But in reality, with those waves of inflammation where your thyroid's getting attacked, you can have bursts of thyroid hormone coming out of those inflamed cells. So then you get a mixture of hyper and hypo symptoms. And it can be really confusing for people. The hyper symptoms can be racing heart, jitteriness, anxiety and panic attacks, insomnia, all of those fun hyper symptoms we tend to think of.
Mm-hmm. And, when you look at the list of symptoms, particularly when it comes to hypothyroidism, it looks an awful lot like fibro symptoms, right? Like body pain, fatigue,
All of
brain
it.
fog, constipation, right?
Joint pain. Sorry, that was another really
Joint
common one.
pain. Yeah.
Stiffness, joint pain. I always include a thyroid screening in a fibro patient. I don't care if they've had fibro for 20 years and their TSH has been run annually by every other doctor. I run it because we look at fibromyalgia and we know that there's issues with energy production. We know that there's issues with mitochondrial function. We want to make sure that every aspect of your metabolism, energy production is working well. And thyroid's huge. I mean, if every cell in your body is affected by it, we need it to be optimal. It's not just checking it to make sure it hasn't become the primary issue. And that's the problem a lot of patients fall into. It's not their primary issue and it gets ignored, but optimizing it could give them a better quality of life.
Right. And I always talk about fibromyalgia as being an amplifier, right? So if you have something else that's causing brain fog, joint pain, body pain, right? And then fibromyalgia is amplifying that, we want to take out anything possible that it could be amplifying. So we want to take out that thyroid piece so that we're not amplifying it.
Yes. It's the optimization plan. We don't need to wait for you to have frank hypothyroidism or Hashimoto's. We want optimal numbers. And there's one other thing that's really interesting, and we might, depending on where you lead me with this, we might get into this in a little bit, but fibro is unique in that it is a chronic illness, right? It's one of the chronic illnesses. And when someone has an illness, whether chronic or acute, they can actually start having issues with how they convert their thyroid. Specifically, they can start overproducing this hormone called reverse T3. And, that serves a purpose, right? If someone goes through, like they have sepsis, they're hospitalized, or they have mono, or they maybe experience drastic weight loss for whatever reason, their body during that period of time will try to essentially slow things down, preserve their stores. And so instead of making proper healthy thyroid levels, it'll start creating a whole bunch of this thing called reverse T3 that blocks all your thyroid receptors. It's sneaky. It just completely undoes all the benefits of your thyroid hormone. And that's great if you're in the middle of like starvation and you need to try to preserve what weight you have, energy you have. But for a chronic illness, what happens? You go into that state and then do we just leave it there? It's not as if your body's going to have a chance to fix it when you magically are cured and have no inflammatory symptoms. So that's one of the biggest things that I screen. I look at reverse T3 levels with my fibro patients always.
That's awesome. That's awesome. And that's actually an area I don't know a ton about. So I appreciate
like
that.
One.
Yes. Yes. So the normal process then, our body is like monitoring how much thyroid hormone is floating around, right? And then yells, sends out that TSH to say we need more, or doesn't yell as loud if we need less. Then what happens?
Yep. So then your thyroid has to take some very specific nutrients to make the hormone. So first, your cells in your thyroid will take in iodine, which we can talk about later, and tyrosine, and it will make T4 hormone. And that's probably the most common second thing you'll see tested. Doctors will do TSH and include a T4 in there. T4 is the primary hormone that our thyroid gland produces. It's essentially inactive. It really does nothing, right? If we're going to be honest, it has very low impact on any part of your body. I call it inactive thyroid hormone. That then has to be converted into T3. T3 is your gas, right? The reverse T3 we were talking about, I like to call that the brakes on your system. That free T3 is your gas. It's at least 4 times stronger than your T4, and it's what really stimulates those thyroid receptors in every cell of your body. Your thyroid gland puts out about 10 to 20% T3, and the other 80% is inactive T4. And then it's up to your liver and your kidneys, every cell, to convert that T4 into T3. And that's a really huge piece because someone might be producing a great amount of T4 and their TSH is beautiful. It's a 1. Their brain is like, oh, I see so much T4. But if they're doing a crappy job of converting the T4 into active T3, they'll have all the symptoms of hypothyroidism with normal.
That's me, crappy labs. Conversion right here.
Well, and that's fibro, right? Because part of what blocks conversion is, well, one, nutritional deficiencies will do it, which is common in fibro too. Specifically, selenium and zinc. You need good selenium and zinc to convert T4 into T3, but also stress hormones disrupt conversion of T4 into T3. And so, if you're walking around with an inflammatory condition and you have adrenal health issues, stress hormone dysfunction, good luck converting well to T3. It doesn't go very well. And so, those people, let's say someone does have hypothyroidism and they just keep taking T4 and that TSH adjusts, but they just feel no better or they feel worse. They're not converting it right.
Mm-hmm. Which is yet another reason we want to come back to the fact that just doing the basic labs that your doctor is running for you and telling your thyroid is fine is not enough of the picture, right? Because you're only looking at a piece of the puzzle and that piece might be working fine, but that doesn't mean all the other pieces are working fine.
Yep.
So I always tell my clients, you want to ask for a full thyroid panel, including antibodies, like use those exact words.
Yes. And I can help with exactly what those are too, because
please do. So what is all that if you ask for a full thyroid panel, including antibodies?
Yeah. So typically, what's usually run is just a TSH, thyroid stimulating hormone. And then they want to see, is it within normal range, which isn't optimal either, by the way. So we'll get to that, but they're just saying, okay, is it high? Is it low? Based on 95% of the people who have this test ordered by their doctor. There is a very good chance if you say to your PCP, let's order a full thyroid panel, they will order a TSH with reflex to T4. All that does is say, okay, if your TSH is like 5 or it's 0.2, it's outside that typical average range, then it will do a T4. So unless you specify specifically that you want a free T3 level, maybe you want a total T3 level, you want a reverse T3 level, you want thyroid peroxidase antibodies, usually that's not going to get included. I agree. People should get a full thyroid panel, but I want them to have a list and know what to ask for because their doctor on the other end of that might have no idea what they need.
Good point. Yeah.
Yeah. So for most people, even without fibro, I'm going to want a TSH, a free T3, a free T4. If they've got any symptoms of fatigue, infertility, anything hormonally off, hair loss, I'm going to run a reverse T3 on top of that. And then if they have a family history or if they have fibro, I always include a thyroid peroxidase antibody just because it's better to catch it early rather than later.
And that antibody test is what shows us if you have Hashimoto's.
Yes. And then there's another sneaky one. There's anti-TG, thyroglobulin antibody. Most people who have Hashimoto's, I think it's the majority technically, also have elevated anti-TG antibodies, thyroglobulin antibodies. I do have some unique birds where that's the one they have elevated and they don't have any anti-TPO elevated. So you want to run both of those. If you're like, I really think I see hypothyroidism from inflamed thyroid, you run them both. And then if someone has symptoms or history of high thyroid hormone, we run a TSI, thyroid stimulating immunoglobulin, to see if they have Graves' antibodies.
And Graves is when your thyroid goes into overdrive and...
Yeah, it's the same issue as Hashimoto's in the sense that it is your immune system that has the dysfunction and it is attacking your poor thyroid gland, but in a way that it stimulates increased release of hormones.
Awesome. So we do these tests. Let's talk about the optimal versus lab ranges. So the first problem I see people running into is their doctors aren't even running the right tests. But then when they do get the right tests, those tests aren't being read the same way.
Yes. And a lot of that is, when you're managing large populations, doing research, looking at medicine as a population, which matters, right? It's important for research and all that. You have to have kind of a wider range, but that shouldn't be how one-on-one medicine is. Medicine should be individualized. We shouldn't be just saying, 95% of the population whose doctor said, I should check your thyroid, this is what they show up with. That doesn't mean that's normal healthy, right? Because most people who are getting a thyroid check, I wish everyone got one every year, but a lot of the time they're not getting it unless they're like having drastic weight loss and hair loss and they think it's Graves, or they're having all the fatigue and hair loss, get hair loss on both ends. It's not fair. They don't run it. So you have to consider the fact that when there is a normal range of, okay, what's healthy? What should your TSH be? That's based off the people whose doctors think they need to have their thyroid checked. They're probably symptomatic, a lot of them. So for example, thyroid stimulating hormone. Most labs say a normal TSH is like 0.4 to 4.5. Optimal, like people actually feel the best clinically and are the most balanced across the board, 1 to 2. Some doctors like more like 1 to 3. I really like 1 to 2. And a lot of my patients Hashimoto's and fibro feel better if they're kind of 0.5 to 1.5. So 1 to 2, very, very different than 0.4 to 4. And
Yeah.
then even worse than that, depending on what medical body you're working with, some medical body, I'm talking like, like Kaiser versus like Legacy, not trying to name anyone, but okay, I'm naming them Kaiser. They tend to not treat until TSH is closer to 10 because
Holy crap.
there is the approach, and that's not, they didn't make that up, right? The view is subclinical hypothyroidism, kind of like saying super mild hypothyroidism, is with a TSH of basically 5 to 10. No. Strongly
No.
no. If you work with someone who does a lot of thyroid, does functional medicine, any of that, 2.5 and up is where you usually start looking at it as subclinical hypothyroidism.
And one of the things I've always appreciated about you as my doctor is that you're asking me, well, how do you feel?
Yeah.
Right? Because each individual body is going to like be happy at a different point.
Yep. It's one of those where, yes, the numbers matter. Even in a TSH that's not functioning well or not always doing what we would expect it to do, I want to see it. It matters most of the time, but it's 50% labs and 50% symptoms. Every patient. Yeah. And that comes down to not just their doses, but also the forms of thyroid and the side effects. Because great, your labs look good with you on T4. How do you feel? If you feel like crap, we need to dig deeper and consider giving you T3 therapy.
Mm-hmm. Mm-hmm. And just to remind everybody, you really do need to see the whole picture.
Mm-hmm.
Part of why it took me so long to have my Hashimoto's diagnosed was I was one of those people that they would just check TSH. And my TSH has almost always been even in the good sweet spot, right? But
Mm-hmm.
it's that T4 to T3 conversion that I don't do well. And then those antibodies, right? So
you're a crappy converter, Tami.
I am a crappy converter. It's true. So it is important to like check the whole picture because you can absolutely look normal if you don't dig deeper. So, yeah.
Yeah. I want to share one thing just because I think it's so important. The reverse T3 issue I was talking about, that's one issue that often, if you find it and you correct it, it doesn't always come back, right?
Oh, interesting.
Yeah, it's one of the good ones, right? So someone might be a poor converter, but by the time it gets discovered, if they've been over converting it into reverse T3, right? Not even just poor conversion to normal T3, but like reverse T3 is high. By the time that's found, it's usually significantly elevated and causing a lot of their symptoms by blocking all their receptors and blocking the good T3 they are making. If you can introduce enough T3 hormone relative to T4 hormone, assuming they're already on T4, you can bring that reverse T3 back down. And then all the other things that you've been doing to help with pain and inflammation, it doesn't back up. So sometimes you can just fix it. And it's not an ongoing issue, which is lovely.
Yes, especially for those of us who have chronic issues, to be able to like tick one off as done would be amazing.
And you know in the first 2 weeks on T3, if it's your friend. The second you put that in there, if you're like, oh my God, this is what a normal human being feels like, you have your answer.
So let's talk about treating these things then, because yet again, that is another piece of the puzzle where the way we traditionally treat thyroid, it doesn't always help. In fact, sometimes it might make the problem worse.
Yep.
So how do we treat this?
Yeah. For some patients, it doesn't require medication. A lot it does. Once again, it's kind of like, well, how far down the road did we catch you? If someone doesn't have frank hypothyroidism, kind of like you, they always had a good TSH, right? And they don't have Hashimoto's. So they don't have a progressive thyroid disease where we know the gland is going to get attacked and sadly murdered over time. But if they don't have that scenario, sometimes it really is nutritional deficiencies, or through stress, they've gotten one of those elevated reverse T3s, and we can temporarily use things that bring down stress level or a little bit of T3 hormone to bring that down, and they'll be feeling better. We check their iodine levels. We tend to ignore that in the US because in well-developed countries, it's no longer iodine deficiency that's the primary cause of hypothyroidism. It's autoimmune. But that's for people eating a standard American diet with a whole bunch of processed food, right?
Iodized salt, right?
We use iodized salt, which has solved the issue of iodine deficiency and enlarged thyroid goiters for most of the population. But flash forward to people with fibro and those chronic illnesses who are making massive life changes in their diet so that they feel better. They're eating whole foods, they're cooking their own food at home, they're using sea salt, pink Himalayan sea salt. They get iodine deficiencies if they don't know to supplement it. And especially if they have a low meat diet, low dairy, right? So some of my patients with the healthiest on paper diet, the biggest iodine deficiencies. And so I actually find a lot of iodine deficiency. And if it's just that, excellent. You give an appropriate amount of iodine, their numbers often normalize and they feel better. On the other end of that, if you take too much iodine, it will actually cause thyroid disease. So it's all about knowing your dose and being careful about it.
Is that why sometimes iodine is considered a little controversial when it comes to like Hashimoto's?
Yeah. So with Hashimoto's patients usually need iodine, right? Just like everyone else. And if they're not getting enough through diet, they need to supplement it. But when you introduce iodine, it can cause the TSH to rise sometimes. And that louder signal is pretty inflammatory to the gland, right? It's getting pounded. Your poor gland is getting pounded. It's still struggling. When you introduce iodine in a Hashimoto's patient, you want to make sure that their TSH is well controlled first. So someone comes into me, they have Hashimoto's, their TSH is, let's say, a 6. I'm going to tell them they don't get any iodine supplementation until we have it down into range. Now, that doesn't mean they have to have no fish in their diet, no dairy products. They don't have to worry so much about the salt they're using, but I don't want them getting one of those like thyroid support blends or something that has iodine added, because that will backfire.
I've also heard that iodine and selenium need to go together. How much of that is individualized or?
Yeah, you don't need to take them at the same time of the day, for example, but do you want both of them? Heck yeah. So the 3 essential things, there's a lot of stuff that goes into thyroid, but the 3 things that really matter are iodine, because we can't make thyroid hormone without it. Tyrosine, same thing. We need it to make that T4 in the first place. And then selenium, that is necessary for us to activate the thyroid hormone into T3. So you need all of them. You need adequate levels of all of them. And then you also need zinc. I think I had mentioned that earlier. That plays a role in it. But the primary 3 things for stage 1 are the iodine and the tyrosine, and then selenium. Yeah.
Awesome.
It's your friend.
And if somebody moves past the point where, just adding in some supplements or changing their diet a little bit is really going to fix the problem, then where do you go?
Thyroid hormone. So I want to say, just because it's very, very important, one of the most common questions I get from anyone the first time I'm like, ooh, this is a horrible number. You're exhausted. Would you like to try a little bit of thyroid hormone? The first question I always get is, well, will I have to be on it forever? Doesn't taking it make you have to be on it forever? And the answer is no, right? If someone has Hashimoto's and significant, right? They have very, very high antibodies. They've been progressing forward. Yeah, eventually you're going to need it no matter what. And regardless of when you started, you will need to be on thyroid hormone for the rest of your life. And it's worth it, right? It's longevity. I mean, just basic lifespan is impacted by thyroid numbers.
And you're replacing what your body has killed off. Your body isn't making thyroid because your thyroid, poor body has killed it.
You're just taking what you genuinely need.
I think of it like hormone replacement, right?
It's literally
it is hormone replacement, but I was specifically meaning like, estrogen, progesterone, things like that.
Well, it's hormone replacement for a hormone you're not supposed to ever not have, right? Like, someone could pose the argument. I love bioidentical hormone therapy, but yeah, someone could pose the argument of, well, you're 60. You're not supposed to have that estrogen anymore. There's no one who can look at you at any age and be like, you don't need thyroid hormone. It's overrated. No, you need it. So if you have a progressive thyroid disease, or you had to have your thyroid removed from thyroid cancer, heck yeah, you are going to be on thyroid hormone forever. And thank goodness for it. It's wonderful. If, however, you just have, your TSH is kind of crappy. Maybe it's a 3 and you have all the symptoms and we want to give you enough hormone to bring you to like a 1 to 2. Nope. If you get off it, you'll just go back to where you were essentially. So there's no harm in trying it when it's appropriately dosed. There is one scenario though, in which taking it can force you to stay on it. There are providers who tell the patient to start taking it and just keep increasing your dose. And regardless of whether it's levothyroxine, which is T4, or like Armour, which is PEG thyroid glandular, if you go up in dose to the point where your TSH, the signal from the brain, is completely suppressed, right, below measurement or very, very low, and if you stay there for years, the gland can start to atrophy because it's not being stimulated at all by the TSH. So yeah, if you atrophy your gland from over medication for a long time, you're going to want to stay on that hormone. But no, thyroid hormone is great. And I can tell you my favorites. Would that be helpful, Tami?
Yes, please.
Okay.
Because I find that, a lot of people are on levothyroxine, Synthroid. That's probably a name most people listening to this podcast recognize, right? But sometimes that actually doesn't fix the problem. If
Yeah,
you're a
sometimes
crappy
it-
converter like me,
Yeah.
more T4 doesn't actually give you what you actually need, which is the T3.
And I think the most important thing I want to say about Synthroid is if you are on Synthroid and your TSH is between that magical like 1 to 2, and you either 1, don't feel better, or 2, feel worse, you need to be with a doctor who's willing to screen T3 and is not scared to give you T3 hormone if appropriate. Because on the one hand, it might make you feel no better if you have a low T3. But if you're that person who has a tendency to increase production of reverse T3, giving yourself extra T4 actually worsens the problem. And so you can feel a few months into the T4 hormone, you can feel worse. You can feel more hypothyroid. And I love catching those because I'm like, we can fix this. So T4 is important. It's the primary thing that our body makes, but I really, whenever possible, love to mimic, right? The balance. I like to have someone on a combination of T4 with some T3 sprinkled in there. And if it's someone who doesn't convert well, they might need more T3 than the average person would need. This can be done without using a glandular. I love the glandulars. Armor thyroid is the most common one. NP thyroid, very, very similar, usually a bit cheaper and has fewer inactive added ingredients. It's a great product.
By the way, everybody, those are called glandulars because they literally are made from the thyroid gland, usually
Yes.
of pigs.
They're piggy parts.
Yes. So not so awesome necessarily for the vegetarians or vegans in our world, but.
Yep. Well, the good news is, my vegan friends, that you can mimic it with the levothyroxine and liothyronine. Those are Synthroid and Cytomel. So when appropriate, I give someone the NP thyroid or Armor because it already has like the 20-80% of the T3 and the T4. Excellent. Every once in a while, that doesn't go great with Hashimoto's patients, which is a whole nother conversation, but I love it. It's all in one pill. You can get the T4 Synthroid and the T3 Cytomel through the pharmacy, and those can be dosed. For example, maybe someone's on 50 or 100 micrograms of Synthroid. There are cute little 5 microgram T3 tablets you can add into that. It's usually best if someone takes them like 2 times a day, but that's not realistic. So a lot of people, we just do it in the morning and it works well enough. So if your doctor's comfortable playing with that and willing to say, okay, what do you look like in the morning? What do you look like in the afternoon, 6 hours after you take your dose? You can really start finding out, are these medications working for you? And if it's not working great, there's always other ways to do it. You can get a compounded thyroid capsule that has any dose you guys want, all in one little pill. So there's a lot of good tricks.
So all those things that you just mentioned there are all things I've done.
Yes, they are. Aren't
So
they?
I think I started off with Armor thyroid. And let me tell y'all, that was life-changing.
T3. I'm telling you, it's the T3.
Oh, it was magical stuff. But ultimately, because I am that crappy converter, it wasn't enough T3. We needed to increase my T3 without increasing the T4. And so that's when I had to split it up, and we did a custom compounded thing for a while. And then insurance stopped covering custom compounded medications.
Yep. Amazing that it ever covered it for you, by the way.
Yeah, it did for a few years. And so now I take, the Synthroid and the Cytomel as 2 separate things. So,
and they work well. And insurance usually covers it. Sometimes insurance doesn't like to cover Cytomel, or they want a pre-auth and then they won't cover it. But there's a magical little thing called GoodRx. And there are programs out there. And so sometimes it's cheaper than your copay anyway.
Yes. And these aren't expensive medications.
No, they're not.
I mean, they have generics.
And there can be absorption issues too. That's sadly, there's not a cream for this like other hormones. You really do have to stick to the oral pills. I do have one gal who's had bariatric surgery. She's a fibro patient. And even though it's not supposed to be absorbed well sublingually, that works for her. She chews up those T3 tablets, and we have played with her swallowing them chewed up versus holding them under her tongue. It works best if she holds it under her tongue. She just hangs out with that under her tongue every day for a few minutes and then swallows it, and her blood levels have been steady. So there are workarounds, even for the crappy absorbers. We find a way.
That's awesome. This just is such a good example of how medicine needs to be individualized,
It really
right?
does.
Your body
Yeah.
and my body are different
Yeah.
and want different things.
And your thyroid needs shift. That's the other thing that's important. You need thyroid hormone throughout your life, but depending on where you're at. So a woman with fibro, or men too, sorry, not to discriminate, but a woman with fibro in her 20s might have very different needs than when she's at an older age and she has lower sex hormones, because our levels of estrogen and testosterone, those actually impact our thyroid hormone levels. So stage of life, other hormone levels, that can affect what you need. So you also have to have a doctor who's willing to run it when you're like, okay, something's off, something has shifted. You want to be able to run it and see what's happening. And then if you're doing a diet change, right? Like if you've lost significant weight or gained significant weight, your dose changes, what you need changes. Or if you're playing with, I think I've mentioned this to you before, Tami, the ketogenic diet.
Yes.
Ketogenic diet has a lot of benefits. It can reverse insulin resistance. It can be fantastic for pulling someone out of diabetes and pre-diabetes early on. There's not a lot of good research on long-term ketogenic diet. But one of the things that I can say is probably a factor in whether wants to do it short-term versus long-term super low-carb diets is it does impact your ability to convert T4 to T3. So someone's conversion is going to be very different on a strict ketogenic diet than it is when they're eating kind of a normal higher carbohydrate intake. So everything matters and labs are magical.
Yes, no kidding. And, with cortisol, with our stress hormones impacting things,
Yeah,
you go through a stressful period in your life, that's going to change the levels of thyroid hormone in your body.
absolutely. And if you get too much thyroid hormone, which, especially with Hashimoto's, where you can have these swings into some hyperthyroidism, when you are overthyroided, as I like to call it, hyper levels, that can actually speed up breakdown of your cortisol. They play together. They play together very much. So if someone has untreated low stress hormone production, their cortisol is on the low end, and you give them a big whopping dose of thyroid, they might actually feel more tired. They might have more issues. And it could be because we're eating through their cortisol.
I picture it like little Pac-Mans going through
Yeah,
and
it's
gobbling up the
yeah,
cortisol in your blood.
it's actually like for Addison's, for Addison's, kind of the adrenal version of Hashimoto's, where your immune system eventually kills off your adrenal glands. If there's an untreated Addison's patient, you throw them on thyroid hormone, you can create a medical emergency. So they go together. They are very, very important. They should both be monitored. I would say for cortisol, get some salivary cortisol just to see what your curve's like throughout the day, but also get a baseline like morning blood draw just to see how high you can get, or is it really low? It's worth looking at.
Awesome. Which is a whole nother podcast episode.
It is fun one. They're connected.
They are. So taking all this good information we've been talking about, what should somebody do with this, right? So they've just listened to this podcast episode. I know you're out there thinking, okay, this is all great, but now what?
Yes. Now,
So what do we do now?
Yes. Well, first you get labs.
Yes,
And like
you
I
get a
said,
good doctor.
yes. So at bare minimum, you fight for a TSH, a free T4, a free T3. Okay. If you can get a nice little anti-TPO, thyroid peroxidase antibodies, and maybe a reverse T3 out of them, that would be amazing. And know your optimal levels. Whatever it comes back at, if they're not willing to help you work on getting to an optimal level, go doctor hunting. You have fibro. You're used to this. Go doctor hunting. You can find someone who will work on it with you. It just takes time. But you want a TSH around 1 to 2. And for free T3, you want a nice like 3.5, right? You don't want a 2.3, a 2.8. So ignore the normal range. Reverse T3 in fibro, I want that under 15. We don't want anywhere like 20, 25, 30. All of that in a fibro patient could be contributing to the level of joint pain, fatigue, brain fog. That's a huge one I didn't mention earlier with thyroid. And then know your different medication options, right? Know that there are options out there. You can have levothyroxine, tons of doses. You can have T3 hormone, Cytomel, once a day, a few times a day. And if you're someone who has issues with a high heart rate and your doctor said, oh, you can't have T3 hormone, sometimes you can. You can get a slow release compounded version. And then don't be shy to ask for an iodine level 2. If you want to supplement, or if you're vegan or vegetarian, you might need it. Find out if you have low iodine so that they can help you fix it.
especially if you're trying to keep salt out of your diet, right? Because
Yeah.
that's where most of our
But I love
iodine.
salt.
I know
Most
salt's
people shouldn't
good.
salt restrict. I'm
That's also
fire
part of the
myself.
adrenal conversation that we will have to schedule you back for.
If you feel crappy when you've gone on a low salt diet, well, please get labs.
Seriously. Seriously.
It may be bad.
I will just say, side note, and then we'll move on. When I started learning about salt and adrenals and like how all of this connects, I started adding a little bit of extra salt in the
Mhm.
morning to like whatever I was having for breakfast. My protein shake, I would put a little salt in it. Oh my God, that changed everything.
Huge.
So, yeah, anyway, we'll come back to this in a future episode. But yeah. So, I think the biggest problem here that I see with my clients is doctors don't know, they don't know what labs to run. They don't know how to read those labs. I told you before we started recording, I was going to ask you this question. Why is this such a problem? Why do
Oh,
doctors not know? Like, why is it so wrong?
it's part of the problem is because I don't believe anyone goes into medicine without good intentions.
Right.
Maybe, maybe a few of them are like, ooh, money, but most people, right, they're going in with good intentions. Part of the problem is that thyroid is such an individualized issue. Everyone's body is so different. You can look at 10 people and you can guess if they're going to be someone who has a problem converting T4 into T3, but you don't really know. And so for the general population, they tend to look at it as, okay, let's just screen their TSH. Let's just screen their T4 if their TSH is looking off. They don't teach much outside of T4 and T3 in med school. And that goes for naturopathic med school too. This is for MD, DO, naturopathic. A lot of what I learned with thyroid, I learned initially through trainings with endocrinologists, separate seminars that focused in on thyroid. Because the basic thing they teach everyone is, TSH goes up, T4 goes down. You want to try some thyroid hormone. So there's a lack of education. I think there's a bit of fear or anxiety, especially among new physicians, to give T3 hormone. And that's because when you're giving someone T3 hormone, you can much more quickly cause side effects than if you give them T4, right? A bunch of T4, that's mostly inactive. You're just going to suppress their TSH. They might get shaky and feel crappy, might have low cortisol symptoms. But if you give someone pure T3 and you give them high amounts, that's a very quick way to make someone overheated, shaky, give them palpitations, heart arrhythmias, make them dizzy, take away their ability to sleep. You really can over-medicate someone with that because it's a very different dosage and it's a much more sensitive thing. And not only that, but there's, it's interesting. There's a lot of endocrinologists my patients see that still say, well, you don't need T3 hormone. Your body doesn't need that. Why would we do that? Even if their blood work shows low T3. And then there are others who are like, nope, T3 matters. If it's low, here, let's give you T3. Let's split it up throughout the day and do it properly. So I think the problem is mostly in the curriculum. Doctors are not being taught adequately about it. And the ones who do it well are the ones who've gotten out there and learned clinically and through other training. So it has to change at the level of medical school. I don't know when that's going to happen.
And
But
to
the
be
good news
fair,
is-
my God, all the things that doctors have to learn in
and
medical
they get
school.
15 minutes with you. It's like, oh, your TSH is a 3. You're fine. Go away.
Right. Next person.
Yeah. Or what do you mean you don't feel good? We brought your TSH down to a 1.
You
It must
should
something
be.
else. We do like some Paxil, which, some people need some Paxil. Those medications can be good. But yeah, it's a lack of training, especially about T3. And then because it's not properly trained into us, you do see a lot of doctors over prescribing and causing a lot of side effects.
Mhm.
And that creates anxiety about giving that. So
Right. You have a bad experience either as the prescriber or the person receiving,
yeah,
right? And it makes you hesitate.
it's good intentions.
Yeah.
It's a failure in our medical model, reaching all the way up to endocrinologists.
Yeah. So, to be honest, this sounds a lot like exactly what happens with fibromyalgia.
Yeah.
People in medical school, you have to learn a little bit about a lot of stuff, right? So you can't go super deep. You've got to learn the basics and then it's up to you to go out and get your specialties.
Yep.
So keep that in mind if you're listening and you're thinking, those symptoms that you're talking about, I have those, or, oh, I'm on Synthroid and it just keeps going up, but I don't feel any better. Probably need a doctor who actually understands a
and
little
is
bit more.
comfortable with T3. I would say like
Yes.
you can get very low doses. So I think a lot of it is, I would actually not be shy. I would ask your doctor and say, hey, if my T3 levels are low, do you prescribe T3? No matter what form they prescribe it in, that I would just outright ask that, because if their answer is no, I never prescribe that, they're going to be too nervous, or they're not going to be confident in how to give it to you.
Or know how to do the fine tuning. Like,
or the
some
tricks,
of this is
right?
an art, right?
Yeah.
Like it's not just if this, then that.
Yeah. And they're not going to be like, oh, I can send this to a compounding pharmacy and do a slow release and give you a little bit of an extra release. Like, they don't know. That's okay. So find someone who knows, because the good thing is this is not a huge mystery anymore. Tons and tons of providers out there. You can find great MDs, NDs, DOs, nurse practitioners that are fantastic at this and will help you with it. It just takes more time and hunting.
Yes. Yes. Any particular places or ways you would recommend somebody go about that hunting?
I have one trick that's interesting. I didn't make up this trick, but because no, I don't have a name of a specific favorite or like a website where they name like, this is your endocrinologist. But some of the patients who found me actually did it by calling their local compounding pharmacy. And
interesting.
Oh, I know. I was like, that's smart. I never would have thought of that. There are compounding pharmacies in every state. Okay. So you can call your local compounding pharmacy and you can talk to the pharmacist. It's usually owned by a pharmacist, or they'll have local providers who send them the constant scripts for like T3, T4, changing the doses. They know in their area who is sending in all of these thyroid medications. And so I've had patients who called the local pharmacist at a compounding pharmacy. I want to be very clear, compounding pharmacy.
Not Rite Aid, not Walgreens, not CVS.
What can you recommend for thyroid around here? I actually think that's the best way to go about it.
Oh, that is brilliant.
Thank you.
And again, not what this...
I like to act like that's mine. I came up with that. No.
No, that's awesome. I'm thinking that would work awesome for low dose naltrexone too, which again, a whole nother podcast episode.
Yep. And hormones. Like, I get different topic, but oh my God, low testosterone in fibro patients. Mm-hmm. You need a doctor who will talk to you about testosterone if you have low testosterone. So call your local compounding pharmacist. They are lovely. They are scientists. They are artists. Call them.
Awesome. That is brilliant. Okay. Anything people can do like on their own? Let's say that either people are adverse to medicine or are having trouble finding a good doctor or like whatever.
Don't have the money to try to see 10 different doctors till they find one who will cooperate. Yeah,
exactly right.
All those things. I would say a very good place to start is to make sure your diet has the foods in it that will give you some of the basic needs. And if you're vegan, you have to do a workaround, right? So you need just very bare minimum, you need enough tyrosine and iodine to make thyroid hormone. So seaweed, fish, iodized salt with your cooking, that'll all cover the iodine. Eggs, dairy products, chicken, meat, that'll cover the iodine. Tyrosine, meat, eggs. There are definitely vegan sources of this, but the highest sources tend to be in those. And that's tyrosine is one you can pretty safely, if you don't have symptoms of hyperthyroidism, right? Like Graves, like rapid heart rate, losing weight, you can definitely take some low doses of tyrosine. The iodine, I would say, unless you're able to screen your level, get it through food sources, because too much iodine really can be toxic. And even though you have to usually do some pretty high levels of dosing of iodine to cause thyroid issues, I have had one who took a very low dose. That threw her into hypothyroidism, and her blood levels showed off the charts iodine. So everyone's different. Her body goes, ooh, and holds on to it and had immediate toxicity. And then selenium. This one I love. Selenium, you can find in some random places. My favorite is Brazil nuts. If you eat 2 or 3 Brazil nuts a day, you will get that 200 micrograms of selenium you need in order to convert T4 to T3. So bare minimum, look at what you're eating. Don't pick up a habit of having a whole bunch of cabbage juice or raw vegetable smoothies every day. That's one. You guys at some point will probably come across goitrogens. I think you'd mentioned soy earlier to me,
yes.
Tami.
Uh-huh.
Don't be scared to have vegetables, right? Like you need broccoli, you need these cruciferous vegetables. The process of cooking them breaks down a lot of the goitrogens. Those are the components within these vegetables, these foods that can actually block thyroid hormone production. And there are chemicals that do that too in the environment, toxins. They're called goitrogenic. But yeah, the reason I talked about the cabbage juice is there are patients who drink raw cabbage juice for health reasons, for stomach ulcers. Enough of that can straight up cause hypothyroidism.
Just
So
because you're blocking
your actual production. Yeah.
Yeah.
It's goitrogenic, but you have to do a whole lot of it. So cook your vegetables if you have thyroid disease. If you want to be doing soy, use high quality soy, fermented products, cooked products. Yeah, mostly.
Don't use your soy protein shake to take your
No, yeah.
Synthroid.
If for any reason you're like, oh, I love soy protein and I take it all day long, or you're taking a bunch of soy isoflavone capsules or anything like that, be careful with timing and maybe get a baseline thyroid. Get a baseline. That's one where a TSH would be useful. Get a TSH, right? And then 3 months in, recheck it and see what it looks like.
Right. Because if this is just like my level of whatever as I'm
Yep.
on my soy protein,
Yep.
whatever, right? Then we can dose according to that. But if you take it some days, don't take it other days. Yeah.
I would be like, okay, I'm going to have this every day for the next 3 months because I like having this. Let's see if we see a shift in numbers. But
yeah. Any other avoids, since we were just talking about that?
Stress, magically remove all stress and pain from your life.
Yeah. If we had the answer to that, right?
Other avoids. And I know it's kind of an overused saying, but I really do often refer to the thyroid as the canary in the coal mine, because that is one moody, sensitive gland. If you get a toxic exposure, thyroid likes to dysfunction. It likes to react. And so it's kind of how you know early on that there's nutritional deficiencies, things like that. I would be careful on just general environmental toxin exposures, right? Like sometimes there's things you can't help. You grew up next to a farm, other industrial things, you've had your exposures. But, avoid chemical fragrances. Try to limit processed food as long as you're using iodized salt at home. Be aware of the products you're using, because a lot of different things actually can be goitrogenic. You can even look it up. There are chemicals in the environment that are goitrogenic. And at this point, they're in our soil, they're in our water. So as much as you can, eat organic foods, avoid added chemicals in your life.
Yep. Which, good tips, just regardless, right?
Yeah, true. Exactly. It's all the things you want to do anyway.
Yeah.
I think if there's anything else in that. Yeah, I would say just be aware that when you go through other changes in life, whether it's a massive diet change, a hormone shift like menopause, or you're a guy with low testosterone, that'll actually shift thyroid levels too. So make sure you remember that, remind your doctor of that. Yeah.
Awesome. Well, thank you so much for being here. And you guys, if you are looking for a good doctor and you're anywhere in Portland, Oregon, please go see Dr. B at Framework.
Especially if you have thyroid issues. I love you people.
I love that you're such a science geek. In addition to your...
I like anything where people are like, oh, I feel better overnight. And then when T3 does that, I'm like, all right, we can all go home. It's been a good day.
I love it.
Thank you for having me.
Absolutely. And everybody, if you want to stay tuned, I do have a couple other resources that I want to mention. So just hang on. We'll have our listener shout out and I'll have those resources for you.
Thanks, Tami.
And that wraps up my interview with Dr. Kaley Bourgeois from Framework Integrative Medicine. Now, if you would like to hear more from Dr. B, I would highly recommend checking out episode 77. We'll have a link to that in today's show notes, but you can also just search on your favorite podcast app for episode 77, Fibromyalgia Treatment with Dr. Kaley Bourgeois. Dr. B is my thyroid doctor, as we talked about in today's episode. But she's also my fibro doctor, and we talk about that in episode 77. If you are anywhere near Portland, Oregon, I would highly recommend scheduling an appointment at Framework Integrative Medicine, either to see Dr. B or one of the other providers in her clinic. I also have a couple other resources for you. In addition to her excellent suggestion about calling a compounding pharmacy to find a doctor that can help you treat your thyroid, I also have a couple other links that can be helpful. One is the Institute for Functional Medicine. You might remember when I read Dr. B's bio at the beginning, this is one of the places where she was trained. If you would like, they have a physician locator on their website where you can find other doctors trained by them. We will have that link in today's show notes. Just go to fibromyalgiapodcast.com/103. The other resource is Dr. Karazian's clinic. Now, Dr. Karazian is where I learned a lot of the information I have about thyroid. Dr. Karazian and Dr. B. That's where I learned my thyroid stuff. Dr. Karazian wrote a book, Why Do I Still Have Thyroid Symptoms When My Lab Results Are Normal? It is a great book all about thyroid stuff, particularly Hashimoto's. And he has an institute, Karazian Institute, with a practitioner locator for people who have been trained by him. We will have that link on today's show notes as well. Again, it's fibromyalgiapodcast.com/103. And if you are the kind of person like me who wants to learn this information for yourself, not just find somebody who knows the information, you might want to consider taking our Certified Fibromyalgia Advisor class. Our next class starts in just a couple weeks on March 28th. And as I said, this is one of the things that I teach in the class. To get more information about the advisor class, I recommend checking out either the special Be a Coach series, those special episodes that have been coming out in the last couple of weeks, or to go to beafibrocoach.com. That's B spelled out B-E, afibrocoach.com. There's a lot of information out there about the Certified Fibromyalgia Advisor class, which is the first step to becoming a Certified Fibromyalgia Coach. But the class is also amazing for patients like you who want to learn as much as they can, to feel as good as they can. Like I said, that next class is starting in just a few weeks, and we do still have space if you are interested. Now I have this week's listener shout out for you. This is from a listener in the Netherlands. She says, I'm listening to episode 6 of your podcast now in prep for a visit to my GP later this week. I am so grateful for your show. I'm one of those people who doesn't necessarily have the resources required for all the known treatment options, but now I feel I can help myself in small ways with the help of professionals and a nice coach via your podcasts and lovely free materials. Being right at the start of my journey, I'm glad I found the Fibromyalgia podcast at the right time. Thank you, Tami. And thank you. I love when I get notes like this from people on the other side of the world that I could never help personally in person. The podcast has long arms and reaches places that I can't go myself. So I'm glad that you're finding the podcast helpful and that you are taking advantage of all the free materials that we've got. Of course, the podcast itself is a free resource. If you haven't gotten a copy yet, you can go to fibromyalgiapodcast.com. You can download both of my books for free. These are not shortened versions. They are the entire whole book. You can get those for free on the website. We've got our worksheets. We've got all kinds of resources out there. So please, if you are someone like this listener in the Netherlands who doesn't have a lot of resources and needs to be smart about where you spend your money on things, take advantage of those free materials. And of course, if you are someone who has a little bit more resources and you would like personalized help on your journey, then by all means, reach out and schedule a consultation with me, one of my coaches, or one of our students. You can find all of that in today's show notes. Go to fibromyalgiapodcast.com/103, and I will see you back here next time. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stacklehouse. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.